Hi friends, this is Smart Medico. Welcome back to Smart Medico YouTube channel. As I promised you, I came back with my first video. Before going into the topic, let's discuss something which is really very important to us. All those who are seeing this video have to take a white paper and a pen with you and write down all the things what I say. To simplify the topic and to prevent confusion, I'll teach you the topics in parts and in diagrams. Okay, let's get started. Total MCQs we get from anatomy are 15. So listen carefully so that you'll have 15 MCQs with you. We are going to start from head and neck. Today our topic is scalp. We are going to learn scalp in 4 headings. They are 1. Extent, 2. Layers, 3. Blood supply, and the 4th one is nerve supply. Coming to the extent of scalp, here is a beautiful box which I have prepared for you. Extent of scalp. Anteriorly it is extended up to superciliary arches. Superciliary arches is nothing but above the eyebrows. Posteriorly, it is extended up to superior nuchal lines, and laterally, it is extended on the both sides up to superior temporal line, nothing but above your pinna. And now we are going to discuss about layers of scalp. Here in the heading, if you observe, only scalp is written in capital letters. Can anyone guess why? Because the layers of scalp can be easily remembered by a mnemonic scalp. I'll show you how. And the first one is skin. It is the outermost layer. It has hair, sweat glands and sebaceous glands. The clinical correlation what you have to learn here is about baldness. Baldness is seen here. Baldness is due to increased androgenic level in the blood. And there are some other causes, but they are not so important. It's the only important thing. This is enough for skin. Next we shall talk about subcutaneous tissue. It is highly vascular layer as it has numerous blood vessels. But in other parts of the body, this subcutaneous tissue is maximum avascular. But only here it is highly vascular. It is dense fibrous connective tissue. Any cuts in this layer causes profuse bleeding as it has numerous blood vessels. To stop the bleeding, we have to press the wound against the bone, that is against the vault of skull. And now about aponeurosis. It is also called as Galea aponeurotica. It is formed by the aponeurosis of occipitofrontalis muscle. This is the third layer. And the fourth layer is loose areolar connective tissue. It is a vascular layer of scalp. So tissue expanders are placed here. Many may not know what is tissue expander. I will discuss that at the end of this topic. It is generally very important for PG exam. Many previous bits have been appeared from this topic itself. I will discuss about it later. It regulates the cranial cavity volume by emissary veins. Emissary veins are valueless. Loose areolar connective tissue layer maintains a bidimensional flow with cranium with help of these emissary veins. Blood from loose areolar connective tissue is carried to cranium and from cranium to loose areolar connective tissue. As blood moves, same way the septic emboli also moves from this layer to cranium. So it is called as dangerous area of scalp. This is the most important thing which you have to remember. And the innermost layer is pericranium. It is connected to the vault of skull by periosteum. And this periosteum is dense vascular connective tissue. And now let us quickly revise the layers of scalp. The outermost is skin, followed by dense connective tissue, followed by aponeurosis, followed by loose connective tissue, and followed by periosteum. And this is about layers of scalp. Let's get into the next topic. And now nerve supply. We shall divide it into 2 parts. Front of the auricle, back of the auricle. First we shall know what is front of auricle. It is completely supplied by trigeminal nerve. The nerves which supply are supratrochlear, supraorbital, zygomaticotemporal, auriculotemporal. Supratrochlear and supraorbital are the branches of frontal nerve branch. And let's know about divisions. Supratrochlear and supraorbital belong to ophthalmic division, and zygomaticotemporal is from maxillary division, and auriculotemporal is from mandibular division. Now I'll make it in a simple manner. Let's start from trigeminal nerve. You all know trigeminal nerve have three divisions. What are they? The first one is ophthalmic, and next maxillary, and next mandibular. From this ophthalmic division, there comes a frontal branch. From this frontal branch, it gives two nerves. They are supratrochlear and supraorbital. From the next division of trigeminal nerve, maxillary division, continues zygomatico-temporal nerve. From the mandibular division, auriculotemporal. And now let's discuss about nerves which supply behind the auricle area. First one is great auricular, second is lesser occipital, followed by greater occipital, next third occipital. The greater auricular nerve is from ventral rami of second and third cranial nerves. The lesser occipital is from ventral rami of second cranial nerve. The greater occipital nerve is from dorsal rami of second nerve, that is second cranial nerve. Third occipital is from dorsal rami of third cranial nerve. For your easy understanding, I have made these tables. If you read and by heart these tables, that is enough for the nerve supply. This nerve supply is not that important, but if any MCQ arises from this topic, you can easily answer if you by heart these tables. And now pause the video and correlate this diagram with the tables which I said earlier, and you will never forget it. And now arterial supply. In front of auricle, it is supplied by supratrochlear artery, supraorbital artery, superficial temporal artery. Behind the auricle, it is supplied by posterior auricular artery and occipital artery. Venous drainage of scalp is by supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein and occipital vein. These names coincide with arteries also. If you learn the names of arteries, you can easily remember the names of veins. And now comes the most important topic for PG entrance exams, that is clinical correlations. First one is surgical layers of scalp. The layers skin, connective tissue layer and aponeurotic layer are called as surgical layers of scalp. That is the first three layers from outer. These three layers are called surgical layers of scalp. And the next is black eye. After a blow to the head, blood comes and collects into the loose areolar connective tissue. This blood cannot be passed into occipital or temporal regions, as occipitofrontalis muscle have bony attachments at these places, but it does not have any bony attachment anteriorly. So blood comes and accumulates into the eyelids. This produces a generalized swelling around the eye and also dome of the skull. This condition is known as black eye. Here it is beautifully shown what is black eye. See the both images shown here. And now last but not least, that is tissue expanders. These are used by plastic and maxillofacial surgeons. It is a permanent implant. It is also called as balloon-like expansion therapy. It is used to grow or add skin or bone or other tissue. It replaces the dead cells. So it is used in hair transplant therapies. Mainly it is done subcutaneous. It is done subcutaneous because tissue expanders should be placed in the avascular layers itself. Remember this, it should be placed in the avascular layers itself. So in all over the body, the avascular layer is subcutaneous tissue. So it is placed in the subcutaneous tissue. Whereas in the scalp, subcutaneous tissue is highly vascular. So tissue expanders cannot be placed here. Tissue expanders here is placed only in the loose areolar connective tissue layer because it is the avascular layer of scalp. Okay, now coming to the MCQs and notes of this topic, I have prepared a PDF for you. I cannot share this here for some privacy problems. So please follow me on my Insta and message me. I'll send you a PDF there. For the details of my Insta account, it is given below in the description box. Also in the Insta, I'll share you about the new videos which I upload. I have made a lot of effort for making this topic easy. So please Comment your opinion about this video below in the comment box so that I can make myself better. Please support me, guys. You know what you have to do. Please encourage me by sharing this video to your friends and to the medicos you know, and also to your respective groups. And also do subscribe to my channel who all did not subscribe yet. Don't forget to like the video, friends. Logging off, your smart medico, a backbencher.